or the time of life, call it what you will, the menopause is something that every woman will go through. However, for many women, this natural process can be a great time of anxiety due to the challenging symptoms that can come with it.
We have been inundated with your menopause questions this morning, and here to answer as many as we can is GP and menopause specialist with menopausehealth.ie. It is Dr. Caoimhe Hartley. Good morning, Caoimhe. Thank you so much for joining us this morning. We'll dive straight in now because we have a load of questions, as always, when you talk about this. Helen wants to know, can you explain perimenopause and menopause to me? How are they different, and how do I know I'm at each stage? Very common question there.
Absolutely, and something that everybody should know. And there is a difference between perimenopause and menopause. So menopause is the term that we give to our final menstrual period. That's all it is. And if you've gone 12 months with no bleeding, we call that postmenopause. But what we're really interested in is what your ovaries are actually doing in the background. So perimenopause is when you are still having periods, although they might be irregular. But what's happening in the background is that your ovarian production of estrogen in particular, a really important hormone, is fluctuating a lot. And you've some months where you may be producing 2 months, and some months where you're maybe not producing a huge amount. And you might not be ovulating or releasing an egg as regularly as you would have previously. So that's the difference.
That's as simple as.
Jen, I'm having terrible hot flushes, night sweats, which is really impacting my sleep. My friend suggested I should try HRT, but I remember my mum back in the day was always very much against it. What are the benefits? What are the risks? Are there people who can take it? Are there people who can't? Are there different types of HRT? Where can I get it? I'm quite desperate to try something new and make an informed decision. I think that, because I remember obviously from growing up, my mum taking HRT, and Jen sounds exactly like, I think, such a generation of women of going, what is it? Where do I get it? Can I take it? You know, it feels when you're facing into it, someone goes, take HRT, quite daunting. So
totally overwhelming, and there's all this information out there coming at you. It's really hard to actually wade through that and know what to trust and what not to trust. And the background to this really is that, I mean, for years there was a lot of talk maybe about the breast cancer risk and hormone therapy that I think has put the fear of God into women when it comes to HRT. What's really difficult about that question is that when we say HRT, that's a really broad term. So there's loads of different types of HRT. There's not just one type. And there's different types of women who are using it for different reasons. Okay, so fundamentally, hormone therapy is a combination for most women of 2 hormones, estrogen and progestogen. The estrogen is the bit that's going to make you feel better. If you're perimenopausal and your hormones are flying all over the place, the purpose of the estrogen is to try and settle that down. So the hope is that your PMS type symptoms that you might be getting start to become more stable. If you're menopausal and you're not producing estrogen at all, we're giving you estrogen replacement to bring you above a threshold where your symptoms get better, your hot flushes, your night sweats, maybe, mood symptoms, vaginal symptoms, all these other things that can happen in women. There's also health benefits from estrogen. So we know that if we're replacing someone's estrogen, their bone density improves. And this is a huge issue because from the time of your last period, which on average is around the age of 50 or 51, we know we lose bone density at a rate of about 2% per year. It's pretty significant. And for that first 5 years after your last period, you lose quite a lot of your bone density. And that's a big risk factor for developing osteoporosis, which is brittle bone disease. And the other health benefit, we think there's a reduction in cardiovascular risks, so things like heart attack and stroke.
So the biggest cause of mortality in women?
By far is cardiovascular disease, absolutely. So that's your estrogen. And most women take it through their skin, or at least that's the modern way of prescribing it. So usually it's a patch
or a gel.
Or a spray. It's actually a spray as well.
It's a spray, because that's a new one, is it?
It is actually new, only in the last, probably the last 12 months in Ireland, yeah. So we deliver that estrogen through your skin. The second hormone, progestogen, its job is to protect the lining of your womb. If I'm giving you estrogen, that estrogen will cause thickening in the lining of your womb, and that can create abnormal cells. We give you the second hormone, progestogen, to stop that from happening. If you've had a hysterectomy and you've no womb, you can take estrogen alone.
Okay.
And in terms of risk, breast cancer is the one that most people, I think, are familiar with. So there is a risk of breast cancer for women who are taking estrogen and progestogen. Women who've had a hysterectomy take estrogen alone. There's no risk of breast cancer with that we know of. But with combination hormone therapy, there is a small increased risk. But putting that into perspective is the most important thing. So we know that if you take up to 5 years of hormone therapy, the impact on your breast cancer risk, if you had to put numbers on it, we'd see maybe 3 or 4 extra breast cancers out of 1,000 women after 5 years of using hormone therapy. That's similar to drinking a decent glass of wine a night. Yeah, you do that for 5 years for 1,000 women, we'd see maybe 4 to 8 extra breast cancers versus the general population. So
So it's
about
actually
putting it in perspective.
it's more if you have a glass of wine a night than if you're
It's probably ballpark.
Yeah.
You're dealing with quite small
Yeah.
numbers here, so it's hard
It'd
to
be worth Jen to
differentiate.
pop into the GP and try and
See, the problem is a lot of GPs aren't really educated in it, and that's
But
the
that's
issue with a lot of
improving,
women
and,
have.
you know,
jump onto the website and
Yeah.
Absolutely, yeah.
Anyway, right, another symptom for poor old menopausal and perimenopausal people is bloating. So we have a question from Kate. What would you recommend for someone going through perimenopause to ease symptoms, especially bloating?
Bloating is really common, and it can be due to something like perimenopause because of overproduction of your own hormones. But there's other causes too, like celiac disease, different things in your diet, even ovarian problems. It's often worth getting checked out by your GP, make sure that you're not missing anything. You might need a scan if it's really severe. It's worth going through all of those steps. Easing bloating, it's often worth looking at maybe a food, like a diet plan, food diary, and see is there anything that's triggering it, are there particular food types that are making it worse, make sure you're not, dehydrated or overhydrated, exercise, all these things.
They'll help.
Difficult things to treat though.
Yeah, absolutely. Molly, my husband says I have to decide to try for a baby. However, I'm in my late 40s. I haven't had my period in a few months. Is it too late for me? Or am I possibly still ovulating?
Late 40s, no periods, doesn't sound good.
True, but I mean,
Could still be help.
on the flip side, yeah. So that's somebody I would say, look, I'd really encourage you to go and talk to your GP or a fertility specialist, and we do blood work and we start to do a workup to see where you might be at.
Yeah.
From a contraceptive point of view, like on the other hand, if you're trying to prevent pregnancy, I wouldn't rely on, I haven't had a few,
Absolutely, yeah.
Last kick of a dying horse. How many people do we know that have accidental children? Twins in their late 40s.
Accidental children, yeah.
But she doesn't know she's ovulating or not. And, just because the period's not there,
So if you're under 50, unless you've gone 2 full years with no bleeding, with no period, naturally, you cannot be sort of considered to not need contraception, to not need birth control.
Okay,
So just get the test, get everything checked out.
Blood's checked.
Now, how long? No, actually, this is an interesting one. Actually, does the age you have your first period bear any relation to menopause onset? I'm 47. I've gone through 37 years of monthly misery with heavy periods. Part of me dreads menopause. Part of me welcomes the end of cramps, PMS, leaks, etc. Sing it, sister. Well, any news?
Well,
on that front?
so it's complicated. Genetics is probably the biggest factor that determines when your periods are going to stop. So often, if you know your mum's history, or if you have an older sister, you often follow the pattern of your older sister. But other things play a role. So the time or age at your first period, that's called menarche, and we think that probably does have an impact. But if you have to be sort of an extreme. So women who have periods at a really young age, they might have earlier menopause. Women who have a very late first period might have a later
There's only
menopause.
so many eggs, and once they run out, they're going to run out.
But you still have about 1,000 eggs, if not more, at menopause. Like you start with,
Millions.
2,000 to 3,000 at puberty, or more. But things like smoking can certainly cause an earlier menopause. Your weight has a factor to play, how many pregnancies you've had, all these other environmental factors too.
Because you wonder generation as well, you see so many young girls getting their period so much earlier. I wonder what that's going to look like in 40 years' time.
That's a global trend.
That's a lot.
Yeah,
But that's not obesity, it's weight, isn't it?
Nutrition maybe
Yeah.
as well.
Yeah.
Okay, so the last one, there's so many we could go. This is such a frequent question. How long does menopause last for? 5 years into it, I still have very bad insomnia, night sweats, hot flushes, you name it, I'm at my wit's end.
Yeah, of course you're at your wit's end. Like, think of the impact all of those symptoms are having on your quality of life. And actually, one thing we didn't mention with HRT, the biggest benefit of hormone therapy, it makes you feel better. So it's the most effective way of dealing with menopausal symptoms, especially things like hot flushes and night
It
sweats.
has a hugely debilitating impact on your life if you're getting more severe symptoms.
And I think that's really important because there's a percentage of women who don't get symptoms and fly through menopause, which is fantastic. And so it's not something we all need to be petrified of, especially when there's really good treatments out there.
Yeah.
But for the women who do get really severe symptoms, there are really effective ways of treating that. Average length of time to get hot flushes is about 5 to 7 years. And things like brain fog, cognitive function, similar scope as well, about 5 to 7 years.
Kind of up to 10 years for some people as well.
And for life, for a small percentage, for the rest
go
of
to
their
your
life.
doctor and try and get a bit of help. God love you. I feel your pain.
It's not ideal. Thank you
once
so
again
much
for joining us, Quiva. We'll
So
see you again because, as always, we haven't got
So many
enough
questions. You can find out more about Dr. Hartley's clinic on visiting menopausehealth.ie.
And a quick reminder that if you have any medical questions, always seek advice from your pharmacist or your GP.
Now, up next, we're talking fashion. We'll see you at the catwalk in just a moment.